What do you think superior might be? Higher, yeah, good. So something that's higher than something else. So this bone here would be superior to this bone here. Okay, good, yeah. So posterior, what do you think that might be? Towards the back, yeah, okay. So remember the anatomical position, in that position there, something that is posterior would be towards the back in the anatomical position, yeah, good. Medial. Towards the middle. Yeah, sounds like middle, doesn't it? So if you remember that midline of the body, so something medial would be towards that midline. Yeah. Distal. Yes. Good. Yeah, it sounds like distance, doesn't it? Yeah. So if you think about your arm or your leg, then a distal part of those bones would be the end of it. Okay, so the end furthest away from the midline. And that's something that is distal. Superficial, towards the skin surface, yeah? So you've got something that is superficial is towards the surface of the skin, okay, or the surface of the body. So then you can see the opposites there. So superior is obviously higher, inferior would be below. Yeah, so where we had this bone that was superior to this one, or this one is inferior to this one, okay? Anterior, we talked about that already. So that's the opposite of posterior, so that's towards the front. That's the anterior surface of the body. Lateral, yeah, so where that midline is, it's away from that midline. So it's on the outside, towards the outsides of the body. Okay. I mentioned it a little bit earlier about the lateral aspect of the bicep. Okay, so the bicep muscle in your arm, and the lateral part of it would be the bit towards the outside of the body. So you can see how these words are really important when you're trying to pinpoint locations for your treatment. So if you've got someone who's got inflammation in an area, and you've put on a Hijama cup, you need to accurately record where you have put it. So you might say that you've put it on the distal portion of the biceps, so that means the bit of the bicep towards the end, okay, slightly lateral. Okay, so then you move out to the side, or wherever it is, and then you mark it on your anatomy drawings as well where you've put them. So distal is distance, the ends of the limbs or the bones, and proximal is the opposite, so that's the bit that's closest to the midline of the body. Okay, and then superficial was towards the surface, and deep is deep within. Okay? That gives you clues as well, especially when you're talking about pain in areas, about what kind of structures might be damaged. So if something's deep and you've got a deep pain or a deep ache, then those kind of things you might think are joint or ligament problems, whereas something that's more superficial might be something to do with the surface, the skin or the muscles, that kind of thing. Okay, so it's, again, it might help you with diagnosis of what they've got as well. There are a couple of things that weren't on the list. Have a look at these. So these bits are only in the hands, so they pertain only to the hands. You have a palmar surface of the hand, which is the palm, and then the dorsal surface, which is the back of the hand. Okay, so that's the palmar surface, and then the dorsal surface there. In the feet, we have a plantar surface, which is the bottom of the foot, okay, and the dorsal aspect of the foot is the top of the foot, so anterior part there. So plantar on the bottom of the foot, and then dorsal on the top. This is where anatomy can become a bit confusing, because you've got certain names for certain bits, and the ankle and the feet and the arms, they have certain movements that they can do that no other part of the body can do as well. So it's, most of it is the same. There are slight differences in the ankle and the feet.